With this federal bill that was signed into law on July 4th, Michigan is estimated to lose $6 billion. That's 1 in 4 Michiganders. 3 million Michiganders. If you're new here, please hit the follow button, share this video, save it, comment at least 5 relevant words, and then double tap to like this. St. Clair County's community mental health relies on 93% of Medicaid for their funding. These dollars directly support mental health, substance use disorder, developmental disability services. The federal cuts to Medicaid would mean that fewer people would be eligible for coverage, reduced coverage for those that are still covered. The increased pressure on local hospitals, jails, schools, and families, closures of hospitals that are reliant on Medicaid, especially in rural and remote areas like St. Clair County. The increased risk to women during pregnancy, childbirth, postpartum. Not only would this impact the individual who would lose the coverage, it would impact all of their staff, healthcare providers, the entire social safety net of the vulnerable community. The MDHHS annual budget is about $37 billion. 74% of that is just Medicaid, $26.8 billion. When you take all of that federal funding out, our state's portion is only about $8.4 billion. So the state is unlikely to be able to fill in those gaps. Where are we going to find $27 billion? So my question to John James and Lisa McClain is, what is your solution to all of these cuts to your constituents? The work requirement for those between the ages of 19 to 64 for able bodies, but what about those dealing with mental health and substance use abuse who have to go in for treatment? And maybe that treatment might take a day, it might take 3 days, it might take 2 weeks, it could take months. Some of them relapse and then they have to go back. So are you expecting them to still be able to work so that they can get their coverage, to be able to get their treatment? I want to take a moment to thank everybody who works in the community mental health space. Thank you for all the work that you do to take care of our most vulnerable population. Your work and your effort and your dedication does not go unnoticed.